Joining us this morning, Kristen McPherson, one of the physical therapists at the hospital, and talking about a type of therapy that's being offered. Kristen, thanks for your time, and what can you tell us about this therapy?
Sure. So the therapy that we are offering is MDT. It stands for Mechanical Diagnosis and Therapy. It's also known as the McKenzie Method more commonly. So this therapy, we've actually been offering it for about 5 years now. Just kind of spotlighting it and giving it some more attention right now. So the method behind it is it addresses pain and any loss of function for patients by looking at either the spine or the joint that's being affected and basically determining which movement patterns lessen the pain and improve function. And then we base our treatments, each bout visit, off of those specific movements.
Yeah, and you have like a specialized certification that allows the hospital to be able to offer this, right?
Correct. So we have 2 McKenzie certified therapists, and they each have over about 12 years of experience. So the certification involves a credentialing program with an entire curriculum that they review, usually via books and other ways of learning the techniques, and then they have to take a competency exam as well. And that's renewed on a regular basis to maintain that certification.
All right, so with back, neck, shoulder pain, maybe some knee pain, everybody listening probably at some point has had one or more of those issues. But why is it such a challenge to treat those, and what is it about this particular therapy that makes it so effective?
So oftentimes with those types of patients, they come in and they have pain wherever it may be, and they might not have any specific injury or cause to that pain, which can make it difficult to diagnose really what's going on, especially if there hasn't been any imaging done. With using this technique, we can still maintain, the ability for the patient to stay active and still continue moving, but base that movement off of what lessens their pain and, like I said, still maintains or even increases their overall function.
And the hospital has been offering the therapy for how long?
About 5 years now.
5 years. Okay, so if a patient wants to find out more, what would they do and where would they go to try to find out more and get this therapy?
Sure. So this therapy we offer at our Diagnostic and Rehab Center in Morris off of Gore Road. That's where both of these certified physical therapists treat their patients. And so just like any other physical therapy or rehab services, the patient would want to go to either their primary care, whichever doctor they're seeing for this problem, and request a prescription for physical therapy in this case, or in another case, occupational or speech therapy. And then that script would get sent to us, and we would give them a call and get them scheduled. Now, if they're looking for this specific treatment, McKenzie therapy, the doctor can put it right on the script that this is what they're requesting. That way we make sure that they get scheduled with the appropriate therapist for their evaluation.
Yeah, so if someone goes in to get treated for some of these ailments, can they just ask, hey, I've heard about this McKenzie method. Is that something that would be for me?
Sure. So if it's not on the script and we just treat it as a general back pain, knee pain, whatever the case might be, you might get with another one of our therapists. But if they've heard of this and bring it up at their evaluation, then we can definitely rearrange their schedule to make sure that they are with one of the certified therapists just to take full advantage of this program.
Are there any other things that listeners should know, Kristen, before they try to find out more and maybe schedule an appointment to get this therapy?
Sure. They're always welcome to call and speak to us if they want just general information before either getting the prescription or coming in. The treatment is definitely a conservative, non-invasive treatment. So it's just using movements and different techniques. It's nothing, with additional tools or equipment, anything like that. So it's just a way to, like I said, find what's really going on and still treat it using some motion and activity.
In our final seconds, any additional points, Kristen, you'd like to mention for today?
No, I think that pretty much sums it up for this. So just feel free to give us a call or talk to your doctor, and we'll go ahead and get you treated.
Yeah, what's the best way to get a hold of folks at the Morris Hospital?
So our phone number is 815-705-7828. But like I said, they'll need a prescription from their physician or nurse practitioner, and so you might be better off to go through that channel as well.
Our guest is Kristen McPherson, a physical therapist at Morris Hospital, talking about the McKenzie Method of mechanical diagnosis and therapy, helping with back, neck, shoulder, knee pain, and more. Kristen, good advice, good information. Thanks for your time, and
Thank
we'll
you.
look forward to talking again down the road.
Sounds great. Thank you so much.